Welcome to Today on Social Media at ESC Congress 2021. My name is Aguiar and I am the chair of the ESC Communications Committee. Joining us today, we have the pleasure of Professor Stephan Achenbach, President of the European Society of Cardiology, Professor Victoria Delgado from the Netherlands, and joining us remotely from the US, Professor Mike Gibson. Hi, Mike.
Hi.
There's been so much interesting science presented at the ESC Congress this year that has deserved considerable attention and engagement on social media. And certainly this is because a lot of the science is addressing common clinical problems, but also helping us move forward in our fight against avoidable cardiovascular disease. One of the very interesting studies presented yesterday was the SAS trial. Stephan, what are your perspectives on the SAS trial?
Well, first of all, Carlos, of course, this trial is perfectly aligned with the mission of the European Society of Cardiology, which is to reduce the burden of cardiovascular disease. And this trial, SAS, is the salt substitution trial. This is an immensely large trial, which took a decade to plan and complete. In this trial, 21,000 individuals at high risk for stroke were randomized in 600 villages in China, 35 individuals in each village. These were selected, as I said, for high stroke risk, at least 60 years of age, either prior stroke, about 70% of the participants had a prior stroke, or uncontrolled hypertension. And then for these individuals, there was a randomization to either receive a salt substitute, in which 25% of the sodium chloride was replaced by potassium chloride, so 25%, 75%, or to continue cooking with with conventional salt. And the outcome was striking. After 5 years of follow-up, there was a 14% reduction in stroke. There was a 12% reduction in mortality. So this trial impressively shows what can be done by salt substitution, not just looking at hypertension, but also at very hard outcomes. Truly impressive.
What would you say about this in countries where, or regions where, the discretionary use of salt is not as big as the amount of salt you have in other ways?
Yeah, I think that's very important that you emphasize this, Carlos. Unfortunately, in our westernized populations, we eat a lot of processed food. And in this food, the salt is already in. So the amount of salt that you put during cooking is not the decisive factors. In our regions, less than 25% we actually put in actively, and 75% or more we consume by the food that is given to us by industry, basically. And this is where public health initiatives need to really be reinforced to make sure that this really damaging intake in salt
a good opportunity for us at the ESC to move forward on that.
Advocacy, here we go, yes.
Another very common issue, another public health issue that is so important, and it's a spotlight of this year's Congress, is sudden cardiac death. And Victoria, what have we learned about the role of immediate coronary angiography in patients who have been resuscitated from out-of-hospital cardiac arrest?
Yes, that is a sort of a recurrent question, because we have had previous trials in patients with suspected ST segment elevation myocardial infarction, where we saw that the results of immediate coronary angiography were not superior to the late coronary angiography. And in this Congress, the Tomahawk study was presented, and I think that with a very important clinical question. In this case, it's a randomized study performed in Germany. And the question was whether immediate coronary angiography would be beneficial for patients who were admitted with shockable and non-shockable rhythm, without hospital cardiac arrest, and with or without shockable rhythm, and without ST segment elevation myocardial infarction or new left bundle branch block. And they randomized more than 500 patients, and in 38% of the patients who underwent coronary angiography, they found a culprit lesion. And the time delay between or reanimation was only 15 minutes. But the results showed that, again, consistent with previous studies, that there was no beneficial effect of immediate coronary angiography. And from here, we can take the home message that, in principle, for specific patients, we don't need to rush to refer the patients to a center for coronary angiography. And we also need to stress very much on education to effectively and timely apply CPR from reanimation effectively.
That's really a very important message as well. Mike, another very common clinical problem is stroke. And atrial fibrillation is a very common cause of stroke. What have we learned yesterday on the role of screening for atrial fibrillation to prevent stroke and to reduce the burden of stroke in our patients?
Well, sadly, 20 to 30% of people with AFib don't know they have it. And the first time they know they have it is when they have something like a stroke. So there's been a big emphasis recently on using telehealth or telemonitoring to try and detect atrial fibrillation that may be asymptomatic. So in the LOOP trial, they randomized 1,500 people to an implantable loop recorder. It had 4,500 controls. These were people at high risk of stroke who were over 70 and had risk factors like diabetes, hypertension. They ended up with a median CHA2DS2-VASc score of 4. And they then said, if you had AFib detected, you're going to, for more than 6 minutes, you're going to get anticoagulated. And what they found was, yes, they detected a lot of AFib. 32% of people with the loop recorder had AFib. That's almost 3 times as much detection as in the control arm, where the risk was 12%. Now, here's the big question. Could they improve outcomes? There was no difference in bleeding. But when you looked at the primary endpoint of stroke or systemic embolization, it went down from 5.6% to 4.5%. The p-value there was not significant, p of 0.11. But when they looked at a pre-specified analysis following folks for 3 years and only including those people with 3 years of follow-up, there the risk went down from 5.6% to 3.9%, and that was a significant p-value. So it does give me encouragement that some of the upcoming trials with larger sample sizes, with enriched populations, may be able to show some benefit to detecting atrial fibrillation and treating it.
Yeah, the topic is still out there. The question is out there. I agree. And we need to look forward to those other studies that are ongoing. Stephan, you're so active on social media. What has it been like to experience pre and during this Congress days on social media? What has it been like for you?
Well, sure. No, I'm not quite as active as Michael Gibson is, for example. I do share the occasional interesting case, but as you say, the traffic on social media, particularly Twitter, which is where I'm active, around ESC Congress was amazing. We had more than 600,000 impressions of our Congress hashtag. 600,000. That's twice as much as last year. But it's not just about the numbers. It's also about the type of information we can convey on social media. For example, the summary cards that we publish for each of the hotline trials and that are available on social media, they're a perfect way to demonstrate how we can convey condensed and very specific and useful pragmatic information using social media. So I think this is a fantastic effort by your team and your team led at the ESC around communications and social media. I would like to thank you very much for it. And it's a great example of what social media can do.
Thank you. And I would like to thank all the 57 fantastic team of social media ambassadors we have out there from several parts of the world, covering 17 tracks of cardiovascular medicine on social media every day during the Congress. Thank you for your tremendous contribution to the success of the dissemination of the science presented at ESC Congress 2021. Thank you for staying with us and have a nice Congress day.